Hi, this is Lou Covey with Fort Washington Media, and I'm here with Chad Nybo and Cynthia Lencioni of CrossTx, a medical referral application coming out of Bozeman, Montana. Now, guys, I've been looking at this market for some time, and there are literally thousands of medical applications out there. What is it that makes you particularly unique?
What makes us unique is we're focusing on an area that's a pretty common problem in healthcare right now between providers, and that's coordinating patient care. There's lots of applications that answer problems within the practice and within their organization, and lots that do patient education, and what we do is help them coordinate between other practices. So we focus on provider to provider communications.
And what kind of information do you send back and forth on this application?
Well, they generally start a process, whether it's a referral, a second opinion, or a consultation, or discharge process between one to many or one to one different providers, and they share. They start this process and they share information back and forth. Obviously, it starts with patient information, but throughout the patient treatment process, they share files, outcomes of image studies, and other relevant information.
That brings up another question that just popped in my head here. Security is a big deal on the internet, but from what I've read, medical applications are not as secure as most applications are in the market. What have you done to deal with that particular issue?
Well, first of all, we've passed PCI DSS compliance testing recently within the last month.
And what
It
is
was
that?
That's that level of certification for security that your banks pass when they put your financial information online,
Okay.
and also for large-scale retailers who process lots of credit card and other applications. Now, we did that because obviously we wanted to have a level of security that we could express to our customers. We passed the test very easily because of the ground rules we set for ourselves early. Now, there's not really a common acceptable HIPAA compliance certification yet. We expect that to be coming within the next 5 to 10 years at the same level as that financial institutions have with their PCI DSS compliance. But basically, the rules we set forth for ourselves early on have allowed us to remain very secure, and that means that patient data is not sent by email. Notifications might tell providers within our system that a referral's been updated, but we don't share any patient information in those notifications. Other than the express action of a provider downloading or exporting patient coordination process from our system in a file such as a PDF, that's the only way data ever leaves our system or is accessible by anyone other than the parties involved directly in that patient care.
Cynthia, what kind of customer are you actually targeting with this?
We really feel that the healthcare enterprises have a significant need for our solution. Not only in a lot of medical markets is there a lot of competition amongst specialist providers to get those referrals and keep those patients for their lifetimes, but also the care coordination challenge is a really big one, and the way healthcare delivery and payments are increasingly going to be made, the focus is not going to be on pay for service or pay for CPT code, diagnosis code. It's going to be possibly a bundled service where collaboration and communication and coordination are going to be of utmost importance to those organizations so that they can watch that bottom line while having the best quality possible. And again, in order to compete with other enterprise healthcare providers in those markets, because people do want to go to the best institutions that they can for their care, and they can vote with their feet and with their pocketbook. But also the payers, the private insurance and Medicare in particular, increasingly are putting pressure on providers to demonstrate value. And that's where we feel CrossTx is going to make a big difference for these enterprises, and consequently those customers who rely on Medicare and who are going to be organizing themselves into accountable health networks, accountable care organizations, or have patient-centered medical homes, and these are very common throughout primary care and larger healthcare organizations throughout the United States as a result of the Accountable Care Act. They're going to increasingly be feeling pain points that CrossTx can address. So those customers and also health information exchanges are a part of everything I just mentioned before. They're a way to create an information backbone across the country. The National Health Information Network has some pilot projects. It's being tested and hopefully will come online in the next few years. But the state and regional health information exchanges are great testing beds for CrossTx to demonstrate how important our solution is to not just moving data, as some solutions do, not being data repositories or data transfers, and not being just a call center or a referral acceptance and scheduling kind of solution, but really being that end-to-end clinical care solution in the cloud for providers to turn to deliver that excellence is going to be necessary to show the value in order to make their organization successful, again, from the quality and the cost perspective.
Okay. And what's the price point on this?
So initially, based on our research with our beta users, the research that we've done talking to customers of various sizes, independent practices and enterprises, we've set, after a free bundle of referrals, our referral price at $10 a referral. And what's great about CrossTx is you only pay for what you use, and you also only pay that referral fee if you receive the referral. We just felt that providers who were sending referrals to specialists or hospitals discharging patients to other care settings, home health or skilled nursing facility, rehabilitation center, those hospitals no longer were caring for the patient, and the receiving organization who's providing the care, typically the primary care, would pay the referral in that situation.
Excellent. Thank you very much, and I look forward to seeing how you are going to succeed in this rough and tumble world of medical applications. This has been Lou Covey with Foot Washing Media. Thanks for listening.